The Expanded Disability Status Scale, or EDSS, is one method clinicians can use to quantify disability in patients diagnosed with MS and to monitor changes in the level of disability over time. As PTs, this can help us meet patients where they are at in our initial assessment and eval, as well as modify intervention as treatment progresses. Jan Kurtzky, a neurophysiologist and one of the most well-known researchers of MS, revised the EDSS used today. Scoring is determined by the values received during the functional systems scores, which will be touched on later in this video.
The FSS assesses 8 separate functional systems. The test is administered in person by a trained examiner, which is most often a neurologist. We're going to briefly review the functional systems assessed in the FSS so that we can understand what this score means in the grand scheme of things. When assessing pyramidal function, evaluators seek to identify the following, and the patient is given a score based on these criteria. Cerebellar function is assessed through observation of truncal and limb ataxia. Brainstem function is assessed for problems with speech, swallowing, and nystagmus. Inability to swallow or speak is designated a score of +5. Sensory function is assessed through sensory testing of each limb. Presence and severity of sensory loss in multiple limbs designates higher scores. Bowel and bladder function is assessed through hesitancy, urgency, retention, and incontinence. Visual function is assessed for the presence of scotomas, visual acuity, and decrease in fields. Cerebral function is assessed for mood alteration, decreases in mentation, and the severity of chronic brain syndrome and dementia. Ambulation is assessed in MS patients to determine their level of assistance and the distance they are able to walk. Fully ambulatory is regarded as being able to walk at least 500 meters. Unrestricted means that the patient is able to walk a distance that is normal as compared to healthy individuals of a similar age. Other areas that can be assessed are any other neurologic findings that can be attributed to the disease.
As a therapist, you would most likely receive this score as part of a referral. However, we wanted to give a brief overview of how the score is determined so that you can better understand what that score means. The individual functional system scores are each taken into account to determine the overall level of the EDSS. Again, the EDSS and FSS assessments are intended to be used in conjunction with one another. It is important to note that a change in the EDSS should only occur if there has been a change of one or more of the individual FSS components. Once the FSS is completed, the EDSS is then scored on a 0 to 10 scale with half-point increments. So how do you grade the EDSS based on the FSS scores? First, you look at ambulation. An EDSS score of 0 to 5 means that the patient is able to be fully ambulatory without needing an assistive device. An EDSS score of 6 to 10 means that the person must have an assistive device to walk or is restricted to a wheelchair or bed. Next, you take into account the other components of the functional system. An EDSS score of 1 to 5.5 means that at least one functional system component is impaired. For an EDSS score of 6 to 9.5, at least 2 components are impaired. Here's the EDSS scale and the grading criteria based on ambulation and the functional scale components. A score of 0 equals a normal neurological exam. A score of 10 means that death has occurred due to MS. Since this is a common scale to quantify disability due to MS, it is important to understand what each level means and how that score would direct treatment.
Well, hello friends. This is Dr. Ken Randall, back to continue our conversation about the EDSS. The limitations of the EDSS are time to administer. It can take up to 30 minutes to complete the EDSS. Ain't nobody got time for that. Complex scoring process. You heard Maddie talk about that earlier. It's pretty wild. Subjective nature. Various aspects of the exam are based on the individual patient's point of view. This creates a subjective element in the exam. Reliance on walking. Many agree this places too much emphasis on ambulation ability. Disregard for patient-specific ADLs. The EDSS does not take into account the patient's specific activities of daily living, work, or hobbies. Fatigue. Obviously, the EDSS is a fairly involved and physically demanding assessment. Due to this, patient endurance is a limiting factor. Despite all of these limitations, the EDSS is often used as a standardization measure for clinical trials.